father as Arden takes it again, now the Manfred called Lord. He's breath-ending, Lord, and whatever would come out of Arden's mouth be shock Manfred, Lord. And let Arden present his death in such a way, Lord, that Manfred will be absolutely stunned by the amount of content Arden has, Lord. Do you think we ask him?
Dear Father, as Arden takes it and call Mr. Manfred, let this call be as successful as the other. Let wise words come out of his mouth, and Manfred be shocked, and use me as the Amen.
Who's on fire? I need water. Wait, ask. Where's wait goes. Mama? It's fine, girls. It's fine. Mama, no. No, it's fine. It's fine. I'm starting. She was busy helping me, but yeah.
What do you want to do?
Nothing at all. I'm starting.
Nathan, how are you?
Hi, Manfred. I am well. How are you?
Good.
How have you been?
I have orders from our dear president to provide some magnetic fields around your fusion reactor.
Okay.
That's
exciting.
Anyway, no, he's very impressed. But he and I share the one concern is that we need a good strategy to implement things in a stepwise fashion so that projects get done and add up to something, because the more you go, the fact that we went from 83 papers to 120 papers to 170 papers within 2 weeks.
Mm-hmm.
So we have to start kicking off things off the list.
Yeah.
I have a few sort of thoughts on that.
Okay.
So in the quarterly update that you sent,
Yes.
the one thing that to me is an interesting entryway would be the fact that you look at you're beginning to understand health and the healthcare system through the lens of a complex system. And then there are many different elements to it. And so it's a question of how to look at that. Do you want to continue pursuing the elements and then see how they might add up to a complex system? Or are we trying to take a little time mapping out what the dimensions of complexity in the healthcare system are, creating this sort of overarching, let's call it, dynamical network structure, and then adding specifically those pieces in?
Okay.
Because to look at the whole healthcare system, given what you have thought about and what you're working on,
Mm-hmm.
I think we probably can get a deeper structural understanding of that complexity. Because I've thought about that quite a bit too, with
Okay.
this class that I teach disease as a complex system. So that's more the disease part, but healthcare is another extension of that one. And then that could provide sort of a structural overview paper that we could publish, and then try to see how the many different elements that you have here in what you call that Clovis systems and other, how they fit in and how they actually inform each other.
Got it, Manfred. Okay.
Explain to me, pick any one of the Clovis items. How deeply developed are they?
Well, it does vary. I mean, when you have ones as old as Clovis COVID, which are like 5 years old, then they are
Yeah, the Clovis.
very
Then I know you showed me that. Yeah.
correct. When you have others that are much much newer, take Clovis Quantum for example. There is like the prototypes that have been shared, but there's not like any stakeholders that have been identified yet. So it really varies in terms of like who is aware of it and how much that idea has been developed. So
Yeah. And so, what's your overall goal with that?
with Clovis Science, I mean, I do
No, with Clovis Science and that whole application in healthcare.
with. So what do you mean, Manfred? Do you mean Clovis Science itself, or Clovis Science specifically to do with healthcare and its
Yeah, let's
applications?
focus on the specifically with healthcare.
Well, I have been researching healthcare for a very long time.
I know.
I have been talking with multiple people across healthcare. So I do have all of these ideas and proposals and thoughts and solutions that I want to try and kind of push, and that is basically all of the ideas of health through Clovis Science,
Hmm.
right? Which is all these different ideas I have. How can I create value? How can I create solutions? And this is, I mean, these are my ideas completely, but how can I use them for the greater good, right? Or to expand the body of
Hmm.
science. So there's so many different applications. It really depends on which project you look at. But
Hmm.
broadly, it's just about creating value in healthcare or in whatever other sector you might look at.
So, but ultimately, what you are aiming for is designing a type of a platform. Hmm?
It does vary, Manfred. So right now, what I'm looking at is so when you look at my interest specifically in healthcare, it is focused in health systems, and this is also why I want to, of course, pursue the MD with ASU coming up soon, right? Because I do want to impact healthcare at the systemic level. A platform, you mean an analytics platform? I'm assuming, or some
No,
other
like
sort of platform.
when I think it's a very related discussion, the way we are looking at what our discussions about what we do in the context of, let's say, DT, because when you brought up the notion that we called it a platform, but you said, well, the DT needs an operating
An
system.
operating system.
So,
Yes,
is this for healthcare a similar structured idea?
it is, but of course, healthcare is much more complicated than just decision theater, right? So this had to, so I'll give a bit of a backstory. So starting about 6 years ago now, I've been mentored by Dr. Dennis Cortese.
Hmm.
So I'm sure you're aware of him. Was the former CEO
Yeah, I know
of the
him.
Mayo Clinic. So he's really been guiding me along this process of looking at health systems. He's of course, as you know, very passionate about value-based care and all these different things. And so looking at it with his guidance, I guess it's a million little things if you want to think about it that way. As in, there's not just one singular OS that I'm trying to kind of bring to healthcare as of yet, but different solutions here and there, and broadly looking at when you think about health systems, what can be
Hmm.
done, right? Of course, I do. In my previous update, Manfred, if you did catch, I am working on a health report of sorts, right? Which is looking at all sectors of healthcare, whether it be pharmaceuticals or whether it be insurance, and seeing what are the problems within there, right? Of course, I'm not an MD or anything like that, right? But I still have this set of insights which I want to kind of share, as well as think what the solutions across health systems could be.
Yeah. So we are. I mean, I'm working with the whole leadership of ASU Health, and one of the concepts that we are developing there
Hmm.
is the Decision Theater for Health right now platform.
Okay.
And the way this is coming together is because the players in that space were not fast acting. So we have one project discussion with Honor Health, and they all want the Decision Theater for Health framework, and then the various departments say what should we focus on, then they argue amongst each other. It might be basically an application as the first module in there about optimizing placement of clinics into the system and how to new ones as well as retrofitting old ones based on demographics and internal data and things like that. Okay, classical complex decision making challenge. We're working with a health system in Saudi Arabia,
Okay.
Saned Health. This is sort of one of the systems there that seems to have a mandate to transform the Saudi Arabian healthcare system, and they have a lot of interest areas. As of yet, unclear what a starting point might be in those discussions. We just had another meeting with one of their leadership people this week, and went very well. But they are now try working with some of the health insurance areas there in Saudi Arabia, but beyond, and see how what their top priority is to sort of create a decision support tool. So there are multiple elements of this
Hmm.
floating around. We don't know which ones will become the first one to turn into a concrete project. But it is, many of them are not unrelated to some of the elements that you have,
Okay.
except that they are more on the level of the decision support system inside of the system and not yet into the deep, compute science depth that you propose with several of those modules. But there is a very interesting emerging uh, framework of overlap. So
Hmm.
that was so with that in mind, I thought, well, since by default, with the way the business development and decision theater uh, operates, it is that we have to be pragmatic, where the clients come in, and sort of sets priorities about what to design. But on the other hand, it would be a shame not to utilize our joint interests and experience to try to understand at least on a structural and dynamical level, the complex systems that represents healthcare as such, because it also
Yes.
would provide guidance for this more pragmatically driven approach. Which of the different pieces are you going to build first? Because
Yeah.
that is who bites first, who provides funds to do X, Y, and Z. So that's a little bit out of our control,
Hmm.
but we don't want to lose sight of the overarching vision.
All right.
So that's therefore my idea was sort of an proposal, where maybe one of the first projects and papers that we can do would be really to say, okay, the health system as a complex system, what is it?
Okay. Yeah.
Kind of question, and then sort of map out different dimensions of it, and you can say, and it's an interesting multi-scale system level approach, because what it does is you can say, well, there's the area where I have probably quite a bit of expertise. So you look at disease or states of health through the lens of complex systems, where that gives you an understanding. Then you have the layer of causation and the layer of treatments. Then you go into the health system, because as you know, you have been at the discussion we had with Michael about that health impact tool, which is sort of the
Yeah.
trivial calculator yet, but we now had several already discussions with stakeholders about which indicators they think they can do something about, and it now moves to the level of, okay, now what are the drivers and what causal models do we have to build
Mm-hmm.
to explore in scenarios the consequences of certain decisions. And one of the things that Holly, the dean of the medical school, keeps pushing us, and I think she is right, and said, okay, when we started this, we were thinking about how to improve it. Now, with the fact that in a couple of months the big beautiful bill will take effect, what do we have to do not fall further behind because some of the consequences? And one of the interesting things will be and we can simulate that, so with the reduction of Medicaid payments in rural areas,
Yes.
it's clear that healthcare will be severely reduced. Offices will close, hospitals will close, clinics will have fewer services. It's a whole laundry list of things. So in the specific case of Arizona, think about it this way: if there is a certain percentage reduction of services outside of the metropolitan areas,
Mm-hmm.
then that will either people will not go to seek care at all, and that's the one pattern. But if
Yeah.
they do seek care, they have to come into the metropolitan areas,
Got it.
which of course will put an enormous pressure on the system that currently exists here. So that's some of the discussions that we have with Anna Hertz.
Mm-hmm.
So if you go into the outlying areas, let's say you are in Fountain Hills, or so in Eastern Mesa, or or in the very far in the West Valley. So that would be the first point of context of people driving in. If
Yeah.
they can't find any healthcare anymore in Payson or in Wickenburg or wherever there are the more rural clinics because they might shut down.
Got it. Yeah.
So how does the system adjust to that? So that's one of the interesting challenges of complex modeling. But this is an anecdotal piece based on a problem that we know is going to hit us. But I would like us to have a much deeper systematic understanding of all those dependencies and complexities of the healthcare system.
Yeah. Of course.
And that would be sort of a very interesting overview paper. And it's this nested area. There's the disease, there's the immediate care, there are the population dimensions, there are external shocks to the system, sort of, anything that we can sort of think of. I think if we lay this out and turn that into a pragmatic paper under the framing of healthcare as a complex system, that could have a very high impact.
Yeah.
And it got me thinking when I read your update. I said, oh yeah, okay, I see where this is going.
Okay.
And then you mentioned healthcare as a complex system. So well, maybe we should start there.
I would like to. Of course, I think we should also pursue CAS papers as well.
Oh, absolutely, absolutely.
But
I just look
looking
at
at
a framing because I think if we get that nailed down over the next couple of weeks or months, then we have a frame where many other things we can hang on to it.
yeah, because as much as AI is my passion across my entire life, really, one thing I've always AI is nothing more than a tool at the end of the day, and the application that I have always been intrigued, and Dr. Cortese and other individuals, and President Crow as well, who mentioned it to me, the idea of human systems and health systems in a meeting with him, right? And
Yeah.
that a whole idea of healthcare and health systems has always been, I think, my primary interest when you look at ways we can have impact or ways we can create
Mhm.
value. So yes, Manfred, I think I would definitely agree, and that would also, because I do have some more things to share on the papers themselves, which I will
Yes.
share.
Well, are we now about
Um,
250?
Maybe. No. I've definitely because I do know that you. Let's see. I'm going to try and share my screen.
You can go ahead.
So you do remember this, Manfred, from earlier,
Yeah,
I hope, right? So this
yeah.
is still my four kind of broad pillars of how I'm
Mhm.
thinking about how we look at CAS um, papers and the proposals, right? Of course, you do remember this, which is the
Mhm.
first set of seven, right? And then the set of six, which I kind of wanted
Yeah.
to look at as well. And then as you asked me to kind of see where else we can look at papers, right? Or where what other opportunities for papers there are, right? I come up with this. Let me actually go to the more detailed view. So I think number five, for example, you can see here. This is
Mhm.
more of the interdisciplinary ideas that I had, and number five and number six are directly in what you're talking about, right? How we frame what we're looking at in health systems. Right? Of course, number five
Yeah.
is more of the health systems piece, more of the people piece, so to speak, the regulatory, the red tape, and everything else. Number six is looking at health systems from more of a evolutionary standpoint, from a mathematics standpoint, to kind of see like the lineage of models and how we can improve care delivery very not programmatically, but I think the word would be very systematically.
Yeah. So to the point six here, um, another one of my students, Tiffany, so she will join us in the PhD program in the fall, just finishes her master. But she works for the last 20 some years as a critical care nurse here in the Valley.
All right.
And so her idea is now looking through that challenge of critical care and everything that goes wrong in there, so a complex systems perspective. And one of the things I learned from her, because I wasn't aware of it on an operational level, big challenge is that there are different traditions in medical education, roughly distinguished between East and West Coast, and then the ones in the middle fall into one of the other traditions. And it matters dramatically where somebody has been trained if you have this interdisciplinary team of doctors that is needed to take care of a critical care patient.
Mm-hmm.
Because roughly the East Coast tradition is faster, but is much more rule based. So they learn certain best practices and procedures and then apply them. The West Coast seems to be more open for novelty and experimentation, but also takes longer. Now, imagine you have a critical care patient who needs urgent interventions, and you have two doctors that are needed coming from those different traditions. You see already an interesting bottleneck.
Mm-hmm.
So, I mean, I think that's why I like this sort of what you call here the phylogenetic method, because that is part of the past dependency that we have in the system, even on the level of the healthcare practitioners and where they come from.
Yeah.
So to have a system about how to understand that, and I think Tiffany will be very curious about that. So we should talk to her about this kind of ideas, because she can provide a concrete use case where this can then be played out.
Mm-hmm. Yeah. That would be interesting.
And so another thing is that there's this fascinating divide about medical education. So there is an organization I think it's attached or affiliated in some way with Dignity Health System here, but it is a kind of modern cadaver lab where people donate their bodies to science and they develop educational modules with those cadavers. On the other hand, medical schools increasingly go into a virtual space. You learn anatomy in environments such as Dreamscape or in VR and any other things, because you could say this might be more efficient for a basic understanding of the complexity of human anatomy. The problem is, once you have to cut into in an emergency room situation, you open up a human being. You don't have time to visualize. It's very messy and dirty. You have to literally stick your hands in there and do something. And if you don't have this kind of tactile experience of having done that, then you are at a loss. And those are, another one of those past dependencies that you have. Say, how are we training those nurses and doctors about situations that they are facing in the real world? So a lot of interesting things. I also like point number 5 here. I think this is a very interesting way to think about constrained surfaces and geometry and topology of those systems.
Okay, yeah.
Because I think that right now, the primary way how this gets visualized is through networks, but networks, of course, have very straightforward edges between them, and that doesn't really represent the high dimensionality of their problem.
Mm-hmm. Yeah. Yes, Manfred. I think of course, 5 and 6 are healthcare related, but I think all 6 are something I want to explore. And of
Oh
course,
no,
if
I
you
think, and I
remember
think you know me. I'm interested in all
all
of
of them,
that
yeah, but
too.
I think you're right
I
that,
just think we have to be somewhat to do all of that. Yeah.
yeah, I think healthcare is great. I completely agree. And of course, the final of my 4 pillars, this is also what I'm kind of looking at. Right? If we look at number 8, there's also another sort of course, industrial is another application, but looking
Yeah.
specifically as like the metabolism of a health system, what would that look like,
Yeah.
right? Or number 6 as well. I mean, I have kind of tried to ingrain health. I mean, that's kind of one of the main pillars of my passions across CAS is how can we apply this to health systems. So really, all of
Mm-hmm.
these can, in some way or the other, we can take bits and pieces and look and use it for that sort of framework that you're talking about, or sort of looking through that lens. Right,
Yeah.
yeah.
I think we could have fun with, or we would have fun with every one of them.
Uh-huh.
But I think it's time because, we can think and think and think and expand. I think we have to start doing.
I think so
So
too.
the
Yeah.
question is, what should be the first concrete problem that we tackle?
Of course. Yeah.
And I do think that if we sort of start on I can't be convinced otherwise, because everything is fascinating here. But
Mm-hmm.
what we could do in saying, if we start taking the top level approach and map out what do we actually mean by health as a complex system,
Hmm.
and really provide a framing for that.
Yeah.
Because it's a fascinating question. Also, we can look at that, and let's put it this way: I sit on too many. Well, I shouldn't say too many. I sit on many committees. There is a health data effort at ASU. There is a health data ecosystem. There is a whole task force of healthcare and AI. There is the Decision Theater for Health. There is educational discussions with the medical school and some of the other schools. There are, layers and layers. And in every one of them, of course, ultimately you're dealing with a complex system, but the perspective gets sort of drowned out by the well, partly by the demands, but also by the mindset of the people in it who don't have that complexity perspective internalized. And then they look at it and miss some of the real connections, past dependencies, long range effects, you know it. So it would be tremendously helpful for all of those colleagues if we could educate them and say, look, if you think about the healthcare system and health at large, that is the level of complexity that you have to keep in the back of your mind. You can then focus on three nodes and their edges, but at least you should be aware what the broader implications are. And there is currently nothing that we could point them to say, read this and you have a better understanding of what we are really talking about.
Yeah.
So I think I mean, this is a very, and I tell you, I mean, you can look at my calendar, how many hours a week I spend in those meetings. And it is this incredible frustration that, you get this, which you probably know by now too. So you get this lip service. Oh, you have to think about the system, but they don't know how to think about the system.
Exactly.
It's an empty phrase. So that's why I think it would be extremely important and urgent to do that.
Of course.
So how about let's do it?
I think so. Yeah.
Okay.
All right.
So then what we have to do is let's sort of start sort of mapping out how that would look like, and how many scales and layers one needs to sort of incorporate, and ultimately. Well, it's a multi-scale and multi-level system. It's probably not completely fractal, but at least a fractal might be a nice organizing principle in a sense.
Mm-hmm.
Because whenever take if you map it on the top level as a network, then every node in that network has its other is another network.
Yeah.
But even there are feedbacks between sort of elements of a subnetwork into higher order nodes in the top network, so it becomes messy pretty quickly. Yeah?
Precisely. Yeah.
And I think then the question becomes, or there will be a need if you want to understand higher order systems dynamics, that you do not want to aggregate that as network dynamics, and then we get into the whole question of topological and geometric representation.
True.
So a lot of what we have here will become relevant, but not necessarily now in depth for the overview paper, because that should really be to communicate to many of our colleagues and the important stakeholders in this health as a complex systems what that actually means.
Precisely. Yeah. Yeah. That is an exciting proposition.
Okay,
Okay.
let's do it. Let's decide here and now that that's the first thing we do. Let's start mapping this out.
Yeah. Mm-hmm.
So, if you start sort of throwing things together or thinking about how are you doing that? Are you using Word documents? Are you familiar with Overleaf?
I am not familiar with Overleaf. Usually, what I do use, is Word or Google Docs or whatever I can, to kind of.
Yeah, I think that because maybe since this is not, I mean, Overleaf is basically an online LaTeX editor. No?
Okay.
So if we well, it's also easy to write text. It basically is Google Docs with higher order functionality. No? But
Okay.
the challenge is that you have to know a little bit about the LaTeX system. You're familiar with LaTeX?
I am familiar with
Okay.
it.
Well, then I think we should start an Overleaf to sort of dump all of that in there.
Maybe as well. Of course, I do really like Word. I've been using that for years to kind of get my
Yeah,
thoughts
well, you can write
across.
in Word and then dump the paragraphs into Overleaf, but if you have to sort of include certain figures, that is of course, well, probably not for this paper, but for subsequent paper, we'll have to include equations and things like that. So
Mathematical
then overleaf is
formulae.
really the way to do it.
Then yeah. I mean, I already have a vast library of my thoughts on health systems and health as a complex system, and I've been working on that for over a year now. Meaning, just putting my thoughts together, but how we can kind of frame this and look at this, or how this could be expressed as a set of mathematical formulae and much more. So I do have quite a bit that already is there.
Yeah, and I
Um,
have obsessed about this for decades, and
yeah.
and I have managed to somewhat incoherently organize it in that class, sort of diseases and complex systems on that level of the of disease. But
Okay.
it's not just disease in a narrow sense.
Mm-hmm.
So I think we both have done a lot so that we can
Yeah.
really combine that
Put it
very
together.
straightforwardly and
Yeah.
see how we can communicate that. Because I can tell you, well, you talk to Danny Cortese and others, I talk to all those people in ASU Health
Mm-hmm.
constantly, and they need, and they desperately need a, a way that would illustrate and that would educate them in what we are talking about here.
Yeah.
Because they talk about it, but they don't know what it means.
And we can give them something to
Yeah.
work. Yeah.
So, and if I think that those are that they need it, that means and they are, given the level of discussions that we have here, they are a little more on the innovative side. So, how
Mm-hmm.
much more of a need will be throughout the whole healthcare system?
Yeah. True. All right, Manfred. Yeah.
Okay, so I think we have something that we are going to do here.
I think so. I mean,
Uh,
this is of course a very exciting thing. I think you said
yeah.
that, if I understood correctly, that President Crow pushed for this as well to look at health systems, or
Well, no, President Michael. So when you sent this to him and me,
yes.
so I think it was on last Saturday.
Mm-hmm.
I get an email from Michael,
Yeah.
and then we had a long back and forth, and it started out um, after he replied to you.
Okay.
I got the email, I think it was a text, I can't remember. Anyways, it says, okay, this is a fusion reactor, meaning you, is a fusion reactor. You need to provide some heavy magnetic shielding that you don't blow up.
Okay.
That was his
That's what
formula.
his analogy. Okay.
Yeah. Anyway, and then we got back and forth, and I told him what we're doing was in the context of DT, and I said sort of really that the more advanced framing of understanding of complex systems, and so I guess what's very much on his mind is of course the ASU Health, that just started the groundbreaking for the new building and all of that. So health came up, and I said, "Oh, we have a whole framework for that."
Yeah.
So I think it would be a good idea to write that paper.
I think so. This paper,
Right.
so other than people like Dr. Cortese, right, who would be like the stakeholders of this paper?
Well, I think it's always good to have a very concrete audience in mind, and I would say the whole whatever a dozen people that I meet regularly in those meetings, sort of the leadership of ASU Health.
Okay.
It gives us a target, what we need to highlight, and it gives us an open, intelligent, but not necessarily informed audience yet. And those are
True.
the ones that we need to convince.
Yeah, that's a
Because
very good way to put it.
the further out you go from this internal sort of ASU based circle, the less educated the audience will be. So we need to be very clear about how we introduce those concepts.
And yeah, I think that's a great way to start, especially because I do hope to be interacting across ASU Health and the numerical school in the near future, right? And of course, you mentioned the new dean, Dr. Lazanby, and so that's kind of who we can kind of have in mind as we look at this. Yeah.
Yeah.
All right, Manfred.
Yeah. So Holly and Joe T, all those deans and their leadership would be sort of the prime target for us. And it's even so if you have a first draft, you would share it with them for feedback. What
That
do
would
what
be,
from your
yeah,
experience,
but
what
yeah,
is yeah.
yeah, Manfred. Well, yeah,
Have you met Danny? Did you ever meet George Post?
I have spoken with him, and he does. I do connect with him quarterly through my updates, but I've not met him face to face. No, not yet.
Yeah, he would be another one of those sort of target audience people.
Okay, that'd be wonderful. But yeah, I've spoken about him. I actually was. I've been talking to him for years now. I mean, this is when I was 12 years old. He actually was. He and I were talking about how I might get an MD, and this was back when I was 12 years old. This is what 2021, I think.
Hmm.
So yeah, I've known Dr. Post for some time. He's a wonderful
Yeah,
person. But yeah, that would be another interesting audience sector.
yeah.
Yeah, Manfred. So I
Okay,
actually
so
have.
let me. So I think what I will do that later today. I set up an overleaf file.
All right.
You should. I mean, I have an old personal subscription, but I think I remember that every ASU member has access to Overleaf. So if I invite you with your ASU email, you should be able to get it. And it's sort of it's an online editor, so just click the link and then it will bring up Overleaf, and it's pretty self-explanatory if you know LaTeX.
All right. No, I do. Yeah, I will definitely try sometime. I do have an appointment later today, but I'll try to
No,
get
no,
to
no.
that at some
I
point.
have a whole series of meetings ahead of me, so I will do that either tonight or tomorrow morning. Just invite you to, health as a complex systems with some title, and then we can sort of dump all of our ideas in there.
That'd be wonderful. Yeah.
And somehow it is less cumbersome than Google Docs because I
All
never
right.
find anything in Google
In
Docs.
Google Docs, yeah, that is difficult. Even Word is a bit difficult, but yeah, I look forward to that,
And
Manfred.
Overleaf, it has a nice organization of projects, and then you find them, and then, it records different versions, and it has lots of nice features.
All right, Manfred. Yeah, I look forward to that. Is there any?
Okay.
Are there any developments on the NVIDIA
I haven't
front?
heard anything but I didn't have time to follow up. I think I ran into somebody who said, yeah, sort of the hardware is about to get installed, or very soon. So
Okay.
then there's this engineering faculty who builds those digital twins of manufacturing processes who will test it,
Mm-hmm.
and then we should be able to have access.
All right. Yeah. Would you know why? From what I understand, there is some sort of delay in this project, or is this just the
I
normal
haven't heard of
course?
anything of a
You
delay.
don't have.
Maybe it is. I mean,
Okay. Okay.
you don't. You never know with those large organizations. What holds something up.
True.
There you have now two. But I always thought we should think about that. We might start playing with that early in the fall, let them figure everything out,
Yeah, Manfred.
and
Yeah.
then we make sure that we get our accounts and have access to it.
When you can. Yeah. Really fall. All right.
Okay,
All right, Manfred. I am.
good. So then we have a plan. We are making some very concrete steps. I
Yeah.
will set up the overleaf, and
Yeah.
then let's just dump our ideas in there.
Yeah. I think so, Manfred. Yeah, that'd be wonderful. I am traveling next week for a bit. There's this Google Cloud conference
Hmm.
in this Google Cloud Next conference in Vegas. And I'll be
Hmm.
traveling for that, and there are a few other places that I want to. Of course, my mom works with Google, so in
Yeah.
correlation with that, and of course, a few other stops I do have across the region. But
Yeah.
maybe this first week of May, sometime we reconnect.
Yeah, the first week of May, because I'm then for 2 weeks in Europe, but this is easy to Zoom, and
Okay.
then, but let's try to get an in-person meeting in that first week of May.
And in person, all right. Yeah, we'll see.
Yeah, let's even, I just enjoyed, we were very productive on the whiteboard.
We were very productive. Yeah, that was a very fun
So,
session on that whiteboard. But yeah, I'll see because I do have quite a few appointments. But
yeah,
sometime
or Zoom is fine, but let's see what we can do.
I'll see if we can make that happen. Yeah.
Yeah.
All right, Manfred. Thank you for your time. This has been a
Okay.
very,
No
I think, a
problem.
productive call. I am excited.
Oh, yes.
Thank
Talk
you.
soon,
Talk very
and let's
soon.
get to work.
Of course.
Okay.
Goodbye.
Bye.